Good day. With this demonstration video, I would like to explain our program consisting of a series of short exercises and simple instructions that will help you to consistently reduce headache, shoulder and neck pain and painkiller usage. First of all, I would like to emphasize that the great value of this program is that it is self-administered and easy to apply. In other words, you will be able to perform it whenever it is most convenient for you without leaving your workplace and with very low expenditure of time and energy. The program aims to eliminate common bad habits that cause an excessive and prolonged contraction of several muscles, and in particular of those of the head, the face, and the neck and shoulders. These habits may provoke some types of head and neck pain and may worsen other types. These habits are usually unconscious: tooth clenching and grinding, biting of the lips, the nails, of skin pellicles, knitting one's brow, and so on. While doing that, one usually also keeps the muscles of the neck and shoulders in a state of sustained and excessive contraction. All these occurs, as I said, without one realizing it. The first aim of our program is to make you aware of such situations and behaviors. Indeed, this is the first important step in order to minimize muscle contraction during the day. Those who practice such habits over the medium to long term show typical signs: bulging facial muscles, worn out teeth, very evident forehead wrinkles. In the website you will find a form that you can download where all the points of the program are clearly illustrated. You can print it and keep it at your disposal as a reminder. I would like to explain 3 simple exercises for reconditioning the muscles of the head, face, neck and shoulders. Let's proceed to the practical demonstration of each point. To perform the first exercise, stand upright with your heels, hips and nape of the neck against the wall. Without moving the rest of your body, bring your shoulders into contact with the wall and release rhythmically. 1, 2, 1, 2. A frequent error is that instead of bringing the shoulders backwards, they are brought upwards. This is wrong. This is correct. The shoulder must then come back to the original position in a released manner and not with a forward contraction. This is wrong. This is correct. To perform the second exercise, stand again with your body and head against the wall. Make horizontal movement of the head forwards and backwards. The movement must be performed slowly, keeping the head in horizontal position. 1, 2, 1, 2. Very well. To perform the third exercise, you should come a bit forward and cup your hands behind your neck. Then, against the counter pressure from your hands, stretch your head backwards and upwards, as if you would like to stretch yourself. Then relax. While doing that, you should keep the muscle of the face and the mouth well relaxed. 1, 2, a bit more extended. Okay. While performing such exercises, you should not feel pain, but at the most, just a bit of tension. Therefore, regulate the intensity of the exercises. Perform all 3 exercises 8 to 10 times. This will take you no more than 1.5 minutes. Repeat the program every 2 or 3 hours. At any rate, repeat the program several times during the day. Now, let's consider a very simple relaxation exercise that you can perform at home once or twice a day. If you look at somebody who is sleeping in a train, you will notice that, being very relaxed, his mandible tends to fall down. Sit down in a comfortable armchair in a quiet room, alone, with your head leaning backwards. Then try to relax as if you were falling asleep. Let your lower jaw drop completely down and keep your jaw and face muscles fully relaxed. In other words, instead of letting your hand drop down, do that with your mandible. Also relax the muscles of the neck and shoulders. Keep this position for at least 15 minutes. Try to think of something pleasant. If you fall asleep, it's even better. In the meantime, apply sources of pleasant warmth of any type. Warm pads such as thermofor, hot water bottles, etc. on your cheek, neck and shoulder on both sides. This exercise may be particularly efficacious for 2 reasons. First of all, to stay fully relaxed for some time every day is already very beneficial. Moreover, the fact of keeping one's muscles very relaxed for a given time increases the capability of perceiving intense muscle contraction during the day. However, this is not enough to reduce the bad habits during the day. In the daytime, at work or at home, one is obviously not expected to keep his mandible in a drop-down position, as though he would fall asleep. Nevertheless, the mandible is often kept in a much too close position. Some people permanently keep their upper and lower teeth in contact. Instead, when one does not speak or chew, he should keep his teeth and lips slightly apart. The upper and lower teeth should never touch each other except when chewing, and lips should be not kept tightly sealed for too long. To acquire this situation, you can apply a very useful, simple trick. Place red labels in strategic sites around your workplace and at home: telephone, computer, mirror, dashboard of your car, and so on. Anytime you will see the label, you will be reminded to relax your muscles if they were excessively contracted. This will gradually become a conditioned reflex. Many patients to whom I taught this program tell me that now they immediately perceive that they are clenching their teeth, whereas they never took notice of it before. As you have surely already understood, this program is simple, but can be very beneficial. Obviously, the more precisely you carried it out, the higher benefits you will gain. I thank you very much for your kind attention.